Hello, my name's Andy Elliott. I'm an advanced clinical practitioner. I have an interest in person-centered counselling, non-violent communication, and polyvagal theory. I'm joined today by Shantigarbha Warren, who is one of my NVC trainers, and we're going to discuss empathy. Not just empathy in one particular area, uh, but specifically for clinicians that are working in traumatic work environments, particularly when they receive complaints that are dealt with from what they might feel is an unfair perspective. So that's kind of the context that I'd like to put forward. And I'd like to introduce Shanti Garba. Hello, Shanti Garba.
Hi there, Andy. Thanks for having me.
Thank you. So you and I know each other because I'm on a year-long course with you, nonviolent communication course, and we've discussed some of the material that we're going to go through.
Yeah.
So I've explained to you about some of the work-based trauma that I've experienced, and
Mm.
particularly in relationship to complaints. So there's another YouTube video that will explain that in more detail. This is pretty much to go through empathy and how empathy can help clinicians in clinical environments in the there and then,
Yeah.
kind of, as a tool to put in their toolbox. Okay. So, would you like to introduce yourself a little bit? Tell us a little bit about yourself because there's a lot to tell.
Thank you. Okay. Well, I was ordained as a Buddhist minister in 1996 and given the name Shantigarbha, which means he whose inner nature is peaceful or peace. And then through that, I came across nonviolent communication, which developed by Marshall Rosenberg. And initially, I got interested because of the applications in terms of conflict resolution, in terms of mediation. But then later on, I realized that actually it was a lot about self-development and growth and development, and I could use it in my personal life as
Mhm.
well. And then later on, I started applying it in workplace settings, in my own workplace, and supporting other people in their workplaces,
Mhm.
um, how to speak to colleagues, how to speak to clients, customers, um, and yeah, how to deal with disputes at work. So quite a range of different uh, applications.
And it's a very different way of communicating to what we learn
Hmm.
when we're young and when we grow up, isn't it?
Yeah, yeah. Well, I mean, we learn whatever language there is, whatever way of speaking there is in our surroundings, and if that
Mm.
includes judging and blaming as the main way of giving feedback, then we pick that up. The tragedy is that when we most need the compassionate support and cooperation of the people around us, when we're in pain, when we're triggered or traumatized or whatever, re-traumatized, tragedy is that we think and speak in ways which make it even less likely we're going to get the support we need from the people around us. So that's what
Yeah.
I sat with, and that's what I still sit with, sort of
Mm.
how to how to do that differently.
And that really resonates with me because in this kind of 2 years since I've been introduced to nonviolent communication and then to polyvagal theory, I kind of been on my own journey of learning how to be different, to be more how I would like to be, and to be seen for how I would like to be seen. And I think it's really important to just have this little quote from Marshall Rosenberg, because my son sent me this, and this was the prompt that put me on the whole
Oh,
journey, which
okay.
is that every criticism, judgment, diagnosis, and expression of anger is the tragic expression of an unmet need.
Mm.
Could
Mm.
you go through what we mean by unmet need?
Yeah. So um, when we're feeling hurt or angry or uh, our sort of instinctive response is to start pushing away whatever it is that's stimulating that, whether it's a
Mm,
person or thing or whatever. Our instinctive response is to create some distance. And the way we do that verbally is by blaming that person or that thing. Uh,
mm,
so it seems quite instinctive. However, Marshall Rosenberg pointed out that actually when we're doing that kind of, he pointed out, well, look what's going on inside us. You know, what is actually going on inside? Well, it's probably that there's some unmet need for safety, perhaps, for respect or consideration, for care, yeah, even for love, connection, closeness, you know, all these things.
Mm.
So he said, well, rather than expressing what the other person is or their behavior, something like behavior, tell them how you are, as in what how you're feeling and what needs of yours are alive at the moment. So it's quite a radical shift. It took me years really to kind of tune into that and to try to find ways to do that, particularly in really trying and difficult situations.
That's kind of being very vulnerable, isn't it? And taking a big risk and telling people how you feel, because we don't often do that. And I think we've talked before about if you have a need that's seen as quite, can be seen as quite selfish.
Mhm. Selfish or weak. Yes,
Mm,
you know, I grew up, you know, as a boy, designated as a boy. I didn't argue
mm,
with that, but I grew up designated as a boy, and you know, feelings were were basically sticks to beat people with. You know, if somebody told you how they're feeling, then you know that was regarded as a weakness, and you use that to beat them, and vice versa. If you told other people how you were feeling, then later on they would use that as a stick to beat you with. So yeah,
something
I
you
grew up
would
with
run
that.
away from then if you used to, if you did that once, the stimulus to
Yeah,
be beaten, you would kind of stop using that, wouldn't you?
keep it to yourself after that. Yeah, just
Mm,
sort of, yeah, yeah. So I grew up with that kind of conditioning. It was only later on that I realized I might be missing something. I might
mm.
be missing some part of life or some aspect of life in terms of vulnerability in relation to other people, and that actually expressing myself vulnerably, my feelings and my needs, that actually invites connection and closeness and even
And they
love.
call that a heart-to-heart connection, don't they? Non-violent
Yeah,
communication.
yeah,
Yeah.
yeah, yeah, yeah.
So is it kind of fair to say that non-violent communication is a needs-based approach to communication, conflict resolution, and emotional connection, and importantly, focusing on fostering empathy by identifying universal human needs rather than using blame and judgment?
Yes, that is an accurate representation, although it's not complete,
Ah,
because Marshall was also very keen on on the social change implications of uh, of relating on the basis of needs. Yeah, so kind of social policy, like what would social policy look like if we focused on human needs and addressing them? And will we have
so that's kind
signs?
of on a macro level, isn't it? Like on a world level, not just an individual
Absolutely.
level. So
Yeah.
it goes through organizations, governments, nations, and global, I guess, isn't it?
Yeah, yeah. We have signs of this kind of social policy in New Zealand, even in Wales, actually, in Wales in their plans for the future, and also Bhutan, gross national happiness in
Yeah.
Bhutan. You know, that's what they look at. You know, they look at people's well-being and welfare. And of course, healthcare is all about well-being and welfare, you know, and needs, talking about human needs, is a way of unpacking that, is a way of chunking that down so that we can actually get more measurable and more specific.
And well-being in work makes people happier, more productive,
Mhm.
and the organization benefits from that, doesn't it?
Absolutely. Yes. And ends up doing things like reducing staff turnover, improving the quality of people's life at work, so they're much keener to come to work,
Mm.
productivity, and so on and so forth. Yeah.
And I guess this is where it's kind of personal for me, is that my feelings about how things have happened in the organizations that I've worked in have made me feel frightened and not wanting to go to work and probably not turning up in the best version of myself.
Mm, yeah.
So I'm hoping that we can look through this empathy through the lens of healthcare clinicians experiencing trauma at work, mostly from a complaints
Mm,
based perspective, and see how empathy can help clinicians in
yeah.
the moment. So you've written a book. I've got it here. I can see it in the
Oh yes.
background. Yeah.
Oh
It's
yes.
called
There it
it's
is.
called I'll Meet You There.
I'll be there. Practical guide to empathy, mindfulness, and communication. Yes.
Yeah, and I've got this and I've read it a couple of times
Mm,
and very much enjoyed it.
mm,
So there's quite a few definitions and interpretations of empathy,
mm.
and they're not universally the same. There's kind of different flavors.
Yeah.
How would you put empathy in a nutshell?
In a nutshell, I just stick to Marshall Rosenberg's main sort of definition or way of talking about empathy. It's very simple. There's no mirrors or smoke. There's no smoke and mirrors. It's just a respectful understanding of another person's experience. A respectful understanding of another person's experience. And that will do in most contexts. Yeah, we don't need to go. I mean, then the rest of it is unpacking that and exploring that in an experiential way. Yeah. How does that sound to you?
That sounds good to me, and it's kind of quite broad.
Yeah.
Yeah. Um, in your book, you wrote what empathy isn't.
Hmm.
Are you able to go through what empathy isn't?
Yeah, so the most common thing that empathy is confused with is sympathy. So I see that you've got that in your notes for this conversation. So sympathy is when we identify with the feeling of the other person. We try to elicit the same feeling in us or that we imagine is going on in the other person. And then we say, oh yes, I know how you feel about that. Oh yeah, yeah, I know about that one. However, we may not, what we call sadness may be different from what other people call sadness.
Mm,
And if we can only relate to people when we're feeling the same with them, feeling the same as them, well, what about all the times we don't feel the same as the people we're in communication with? I mean, probably most of the time, yeah, unless we're in love with them and they're in love with us or something, some quite special scenario. So I want a way of connecting with people, even when I'm not feeling this, especially when I'm not feeling the same feeling as them. Yeah. And that comes through empathy, which is acknowledging or respectful understanding of the other person's feelings and their underlying needs, their underlying motivations. That's the key thing that Carl Rogers talked about. He talked about feelings and the underlying motivations or needs. And if we can connect with both of those, then we've got a more reliable connection.
So I guess in what you're saying, it's about not identifying with the need yourself, but
Mm.
being able to describe it or feel it from their perspective, not your own.
Well, not identifying with their feelings, but nevertheless feeling a sense of commonality with their needs,
Mm,
even if I'm not, that's not what I need right at the minute. I can still say, if somebody says I need love, even if I'm not needing love at the moment,
mm.
I still have a sense of, oh yeah, okay, well that's something which enriches human life. I can still
So
feel that
you'd
sense of
recognize and
commonality.
acknowledge that and
Yeah,
kind of be totally okay with that. And
yeah,
that's from their perspective, not
yeah.
from your perspective. Yeah.
Absolutely. Keep two separate accounts. It's like what's going on for me, what's going on for the other person. But at the same time, I'm tuning in. This
Mm.
is the more experiential element. I'm tuning in to what's going on for the other person in a kind of sensing kind of way. Yeah.
Mhm.
So that's sympathy. But then we've got a few more that are less likely to be confused with empathy, but sometimes are. Things like collusion, agreeing. That's not empathy. That's agreeing. Those are two
A
separate
lot of
things.
people want that though, don't they?
Well, a lot of people want understanding for what's going on for them. If they get that, they're not so bothered about whether you agree with them or not. But so long as they get understanding for what's going on for them, especially if they're in pain, yeah, but
Mm.
not only if they're in pain.
And
So
empathy is not endorsement, is it? It's not
that's right.
endorsing.
Empathy and agreeing are two separate things, and if you keep them separate, you can stay in that kind of empathic space. If you get them
Yeah.
confused, that's gone. That possibility of really empathizing has gone. Yeah.
Mm.
So we've got sympathy, we've got kind of collusion or agreeing. Then there are a few other ones like pity. So
Mm.
pity implies, oh, you poor thing. So it's a kind of implies a power differential.
Patronizing.
Yeah, it could come across as patronizing. We've got educating, like, oh yeah, you could really learn something from that, couldn't you? That's not empathy. It's not likely to be received as empathy. It's
Mm.
it's encouraging or inviting a person to reflect on their experience. Fair enough, but that's different from empathy. Empathy is when you stay with the person's experience and allow that to unfold at their own pace.
Mm.
So
Anything
those are a
else?
few things. Yeah, a few things. Yeah, maybe storytelling as well. Sometimes storytelling really helps create connection. If you bring the storytelling in too early, it can just distract people from what they want to say.
Is
They're
that like saying, "Oh, I've had that happen,"
yeah, that's it.
and
Yeah.
then you start to tell your story, and you shifted then, haven't you?
Well, yeah, that's right. The attention has shifted from what they wanted to say to what you want to say. And of course, among
Mm.
friends, that's perfectly natural and, happens all the time. However, people usually want empathy first, or they want acknowledgement first, at least that you're willing to acknowledge what's going on for them, give them the space to unfold. Yeah.
And I can't remember who said that was a gift. Was that Marshall? It's a gift to give empathy or
Yeah,
offer
yeah.
empathy.
Presence is a gift. Just giving our empathic presence, our attention to other people is a gift, a wonderful gift. Yeah.
Yeah. So, is there a way that you can talk about empathy from a non-violent communication perspective, or has that kind of included everything that
Yeah.
you would want to
Okay.
say?
Yeah. Well, what Marshall Rosenberg did in particular was, um, well, he trained he did graduate classes with Carl Rogers, so he got that kind of understanding of empathy about feelings and their underlying motivations. But then later on, he realized that it was easier for people to grasp and make sense of if he talked about feelings and their underlying needs, so universal human needs.
Mm,
And he really just stumbled upon that as he was teaching and finding out how to teach in a way that was. But as soon as he started using this word needs, feelings and underlying needs, then suddenly, bam, it's like, okay, a lot more people could understand what he was saying. So, yeah.
and people might not know the difference between feelings and needs, but
Mm,
if you look on the website of the Nonviolent Communication website, there's
mm,
often a list of feelings
mhm.
and a list of universal needs because needs
Yeah.
aren't the same as feelings, are they?
Yeah, that's correct. Yeah, that's accurate as I understand it. Feelings are the affective state, what we sense in the body.
Mm,
So feelings are here rather than thoughts,
mm,
which are up here, kind of tend to come from here. So feelings are in the body, and then needs are more of the flavor of motivation. So they have a kind of intentional or motivational element. I mean, you know, and physical ones like like thirst, hunger, protection, safety. These are bodily drives. So we have physical
mm,
needs, we have psychological and emotional needs, and even
mm.
spiritual needs. So that's where you might talk about needs as the life-giving qualities or life-enriching qualities. Yeah.
So, just for people that haven't come across non-violent communication, we talked about judgment very
Mm.
early on and
Mhm.
criticism, and that was
Yeah.
in um, Marshall's quote.
Mm.
Um, I know it's not a linear process; it's very simplified. But non-violent communication talks about observations, feelings, needs, and requests.
Mm.
Now, particular to kind of the anger, frustration, feeling of betrayal, feeling of being alone, feeling of being hurt and sad by some of the things that have happened to me. We did what was called an anger dance floor exercise
Oh.
at the last
Mm.
workshop. I
Mhm.
wonder if you could just run through that because it goes from anger, looking at the judgment that you've got, and
Mm.
then identifying what needs not being met.
Yeah. Yeah. Okay. So Marshall talked about four feelings in a as a their own category, so to speak, and he talked about anger, guilt, shame, and depression.
Mm,
Now there may be one or two more as well that kind of, but we'll just stick with those for a minute. So he got anger, guilt, shame, and depression. And he said, well, yes, he hears them as feelings. He understands that those are feelings. However, there's some untranslated thinking going on in the background,
mm,
some untranslated
mm,
should thinking going on in the background. So in the case of
mm,
anger, it might be something like, how dare they treat me like this? You'll
Mm,
never get away with that. Nobody talks to me like this. This is our thinking. Yeah.
mm,
The feeling might be like burning in the chest, burning pain in the
mm,
chest, steam coming out of your ears, kind of
mm,
clenching your fists. So these are the feelings in the body. Yeah.
mm,
So in the anger process, anger, we start with the feeling in the body.
mhm.
So whatever that is, whether that's the psh or
Yeah.
the kind of, we start with feeling the feelings in the body, not suppressing or repressing them, but actually feeling them in the body. Then we move to listening for our thinking. Nobody treats me like this. How dare they? I'll get them back, whatever it is.
Mm,
Yeah, listening for the thinking. And then from the thinking, we go to the needs. We connect with the underlying needs, like what were you really longing for in this situation?
mm,
So it's a slightly different process from how we treat other feelings, but
mm,
it seems to work experientially. So,
mm. And I guess for me, some of those needs were feeling the need to feel understood, the
yeah.
need to feel that I was doing my best and that I was doing the appropriate
Hmm.
things that needed to be done, although they might not have been seen that way by the patient. And I
Okay.
was also looking for somebody to have my back and support me.
Hmm.
When we
Hmm.
come to the role play, I'll explain that a little bit more.
Okay.
And I think from feelings, you put your hand on your chest and you put that there. People don't really relate to feelings as I observe it that well. That came up for me
Mm.
when I did my counseling course many years ago, that we can't identify feelings. And there's a lot of work about somatic therapy these days, about experiential, exploring how you feel. And some of the things from certainly from the polyvagal theory course that I did is sometimes when you feel that your jaw's clenched,
Mm.
you did your fists.
Yeah.
I sometimes feel like I'm being choked,
There
and
you go.
sometimes I feel like my legs go really cold.
Ah,
Yeah,
yeah.
which is a very reptilian shutdown response. So there's a lot to this feeling. How can people get in touch with their feelings?
Well, if well, the first thing is, where do you look for your feelings, or where are you going to look? And the number of times I've asked that question, and people look up like this, as if they're going to find it in the sky.
Yeah,
What they're
yeah,
feeling, you're
yeah,
going to find it somewhere up there in the sky.
yeah, in a
Whereas
cloud.
they're never going to find their feelings there because feelings are down here in your
Yeah.
body. Yeah, and you might want to start checking in around your heart, perhaps a bit further down, perhaps further up, maybe maybe in the shoulders, the chest, maybe in the neck and head, like you said, sometimes even in your legs, like you said, when your legs went numb and cold and numb.
Mm,
Yeah. So it's a sensing. So if you want to connect with your feelings, it's sensing your feelings. And if you start a sentence saying, "Well, I think and then you say, "I think I feel," well, actually, that's a thought. You're going to get to a thought as
mm.
soon as you
You've
introduce.
bypassed it.
Yeah, yeah,
Yeah.
yeah. Or you've got a mental representation of that feeling. So it's
Mm,
really the somatic experience, what you were saying, somatic experience in the body. And in this, I follow, the way I learned nonviolent communication was very, very much a somatic process. I learned it from somebody who was an Alexander technique
mm,
teacher, that was just her language and her way of working. So I just
sure.
learned that from her. But later on, I also did mindfulness teaching and found that actually there's a whole kind of literature and, sort of a whole kind of school of somatic experiencing, sort of through mindfulness and
Mm.
so on.
And sometimes when we start one of our workshops, we sit down and do a grounding or an entering kind of
Yeah,
slight meditation where you or Jazina will take us through what we feel in our body, not to be critical of it, but just to be a noticing of what's going on.
yeah,
That kind of
yeah,
helps you get in there.
yeah. We call
So
that I would call that arriving exercise or kind of
arriving, yeah.
yeah. And it's basically a body scan with and then feelings and then the underlying needs. Yeah,
Yeah. Okay. So if you're in a clinic and you're feeling under threat and dysregulated and feeling hurt, and
Okay.
frustrating
So I'd like to come in
techniques.
there. So I'd just like to come in there. So we're just talking about feelings and being clear about what are feelings. So
Yeah.
under threat for me is an interpretation
Okay.
of a feeling, and I'm wondering what the feeling would it be scared or fearful?
Scared, fearful, tight,
Okay.
feeling
Yeah.
confused. Is that a thinking?
A confused works for me as a feeling. I can get a feeling tone from it. Yeah.
Yeah, it's kind of an uncomfortableness
Sure.
and
Sure.
yeah, an uncomfortableness and a desperate, this is a need, it moves to a need, a desperate need to feel understood.
Yeah. Okay. So feeling desperate, feeling scared and desperate and needing to be understood, needing
Mm.
understanding. Okay. Yeah. There we are.
So for when that happens, what can you do to get in touch with things as a clinician in the there and then moment? You got any
So
tips?
yeah. I recommend doing a quick check-in, a quick kind of internal check-in. It might only take a moment, might just be a blink of the eyes, like I just did there, where you
Mm.
just check inside and you notice your internal state. And as you say, you're feeling confused and desperate and scared and needing to be understood. And of course, you might also want to do that outside of the situation, just as a way of kind of prepping yourself, like what, uh, prepare, like before I go into really challenging situations, I actually do some preparation, some sort of self-connection preparation. And I
Mm.
imagine I say to myself, Shantigarbha, what are you really scared of happening here? And then I kind of imagine that, and then I do some self-connection in that, for that imagination, for that
Mm.
situation, so that when I go into it, I've already got some resilience, some
Mm.
resources. It's not
Mm.
just doesn't just take me by surprise and sweep me away.
Mm.
Yeah.
I know from one or two times I've actually said, "Oh, please excuse me a second. I've just got," and I go out of the room. I need to
Yeah.
disengage, and
Yeah.
I've gone and run my hands under the cold tap or my
Oh,
wrists,
okay.
or
Yeah.
I've done three deep blowing out candle breaths, and
Yeah.
I've kind of found that's helped to get me a little less triggered.
Hmm. Yeah.
Now, one of the things I think is interesting to talk about is self-empathy before empathy.
Hmm.
And I guess some of this is recognizing what's going on for you in the
Yeah.
moment. What
Yeah.
can you say about self-empathy?
Yes, well, this is the moment of connection that I was just describing there, and that you were enacting when you were showing me, breathing out or kind of running hands under cold water, or sometimes people do, I do, but sometimes I do a bit of shaking, just kind
Mm,
of shake it off, as long as oh, nobody's looking or somebody,
mm,
I feel comfortable with doing that. Or I also sometimes just put my hand on my heart like this. Again, probably not when your boss is watching you, but
mm,
kind of if you have a quiet moment, like you said, you just say, "Oh, just a minute, I've just," and then you pop out for a moment, and then you're back, back
mm,
30 seconds later. Yeah. So sometimes I put my hand on my heart like this. Uh, but generally speaking, just checking inside, noticing what I'm feeling and what I'm needing,
mm,
especially if it's difficult to imagine getting those needs met in that situation, especially so that moment of self-connection that will give me some resource for connecting with the other person and
mm,
reaching out to connect with them and being curious about their world. Yeah.
mm. So is it kind of a precursor to offering empathy or trying to extend empathy to another? Kind of puts you in the right place?
I would highly recommend it, yes,
Mm,
as a practice before
okay.
reaching out to others, because otherwise, if you reach out to the other person in your confusion and hurt and anger, that's what they'll get. That's what
Yeah.
they will receive. They won't receive empathy. However,
Mm,
technically proficient you are at empathizing, they'll
yeah.
just receive your anger or hurt or confusion. Yeah, that's what they'll take away from the conversation. Yeah,
Yeah. 100%. I agree with you.
yeah.
Um, one of the things that I was interested in is because I've learned how to be more empathic, and I've
Oh,
learned not to criticize and judge myself for not being empathic in that moment and realizing what you can do differently next time.
mm,
But one of the things that I feel sad about is that I often don't get empathy from the organization that I work from. And I
mm,
wonder what there is that can be said about that.
mm. Well, I mean, what I choose now just to acknowledge what you've said there, because it sounds like a painful, really painful, ongoingly painful experience that you
Mm,
haven't had the understanding you would like.
mm,
You're longing for understanding for your situation, for the impact on you in a situation in an institution which has as its goal well-being and welfare,
mm.
presumably also for its staff.
Yeah,
Mhm.
yeah. And I
I
don't
guess
think
it's
that's there. I think there's something
right.
missing. There's a missing
Ah,
ingredient. I really
okay.
do believe that. And
Mm,
it's interesting
okay.
because I was watching a program the other day that was a healthcare program drama, and
Mm.
the person said to their boss in a clinically difficult situation, "Thanks for having my back.
Ah,
I
yeah,
really felt you were there for me."
yeah.
And he said, "Well, that's what a boss is for."
Oh, yeah.
And I don't see that happening that
Okay.
often
Oh, okay.
in the complaint scenario,
Mm,
but that's something
mm,
for another podcast.
okay.
Um, so I was wondering if it would be okay now to go through this role play situation, if I give you the scenario.
Yep.
Maybe we can look at it from self-empathy for me,
Hmm.
empathy for the other, maybe what I could do differently,
Yep.
and what I can do to get some empathy and understanding from the organization. Would that be
Yep.
okay? Yeah.
Yeah. Yeah.
Okay. So this is probably a very common scenario that happens for a lot of advanced clinical practitioners that work in general practice. You get somebody come in who's got viral symptoms. They've had runny nose, cough, 4 or 5 days in the middle of their viral trajectory because viruses will last for 7 to 10 days and there's no way of cutting them short. But
Sure.
people get very upset about them and they're not very resilient about health and they reach out because they're concerned and they think they need antibiotics.
Right.
So, this particular case, the person, I'd explained very gently to them that I thought their symptoms were viral,
Hmm.
but he was very adamant that they weren't. And this is the challenge that we often get is
Mm,
some of these perceptions or ideas from a patient are what I call almost immovable,
mm,
and that presents the difficulty. So I ended up saying, and I realized now that I would do this slightly differently. I said, I've explained to you in as nice a way as I can that you've got viral symptoms, that viruses last this long. And he just looked really angry. His eyes were giving me daggers,
yeah. Yeah.
which was making me feel more frightened, I guess,
Yeah.
and concerned. And I he kept saying I need antibiotics. And at some point I got to the stage where I said, look, I can't be bullied by you into doing something that I think is not right. And
Hmm.
it's interesting that that is a very common phenomenon because 90% of GPs in a survey a few years ago identified that they frequently feel bullied by patients to do things that are inappropriate.
Mm,
And that doesn't equate to what I consider good healthcare and good medicine.
right.
So the
Right.
fellow walked out and he was really angry
Yeah.
and he went to the receptionist and the receptionist appeased him very quickly and said, we can give you an appointment with another advanced clinical practitioner today, which
Hmm.
he declined. He said, no, I want a doctor. So they gave him a doctor's appointment the next day.
Hmm.
He saw the GP and the GP gave him some antibiotics, which is what he wanted. And he wrote in the notes viral symptoms. And I kind of felt really betrayed.
Mm,
And I know a lot of my colleagues feel that betrayal. And
mm,
when the person had finished, he wrote a letter of complaint about it and
mm,
said that if I didn't know any better, I would say he didn't like people like me. And the man was either Indian or Pakistani origin, which I found hurtful.
mm,
And when I went to the GP to explain that this wasn't okay, the GP said to me, "Ah, just ignore it. It doesn't really matter."
mm,
And that my
mm.
feelings of no support.
Mm, mm.
So that's the kind of scenario. So I wonder how I could
Yeah,
offer myself self-empathy in that
yeah, yeah.
situation to extend
Okay.
more empathy to the patient, because you kind of
Yeah,
have to work hard to give empathy, don't you, or offer empathy. It's a very difficult thing to do.
can be, can be. Well, let's start first of all just with some self-empathy. So that word betrayed, when I hear that word betrayed, let's say if I'm doing a mediation, if I hear that word betrayed, I know I need to translate that word into feelings and needs as quickly as possible, because otherwise the mediation can just go. "No." So when you say I feel betrayed, it's probably one of those words like anger, guilt, shame, depression. It's probably got some
Mm.
untranslated thinking. So what's that feeling in the body when you say I feel betrayed? How do you feel in your body? Do you feel like deeply hurt, angry?
Hurt, cold,
Okay.
confused,
Yeah.
alone,
Yeah.
unsupported.
Okay. Well, that's the need for
Yeah.
support. Yeah. Yeah.
Um, Confused,
Angry.
hurt, angry. Yeah.
Okay.
Um, Disrespected.
Okay. I'm hearing that as the need for respect.
Mhm.
So what I've got so far is
And
feeling
actually
hurt.
quite tearful and wound up, tight.
Okay.
Really, really like I want to go, no,
Yeah. Yeah. Okay. So I've got uh, tight, tearful, upset, hurt, cold, confused, angry, because
mm,
those are the feelings. Those are the elements. The feeling tones. And then because you need support and respect. Is
mm.
that roughly how it is for you?
Yeah. And I think fairness and
Yeah.
justice,
Okay. Fairness. Is that
because,
fairness? Yeah.
yeah, because when I did my training years ago, um, one of the things that we did was antibiotic husbandry and the importance of not over prescribing antibiotics, because
Yeah.
they do an awful lot of harm when
Yeah.
taken when not needed, and it leads to mass cases of not being able to respond to antibiotics because you've been
Sure.
previously exposed to them. It
Sure.
affects your gut biome. It's linked with mental health problems later in life.
Yeah.
So there's a lot of reasons not to do this. So it just seems to me, and I know we need to try and think of not right and wrong
Yeah.
thinking, but I would say it's not life-serving to do those
Yeah.
things.
Yeah.
And that frustrates me.
Yeah, yeah. And I'm also hearing that because of what your understanding of over prescribing antibiotics, it's not in integrity for you to prescribe them when they're not indicated. Is that how
Yeah,
it's?
yeah,
Yeah.
yeah.
So in terms of the needs, I've got support, respect, fairness, integrity, and contributing to life more broadly. Yeah.
And it's a social responsibility.
Yeah.
We're in a very privileged position where we
Yeah.
offer healthcare and offer treatments and things.
Yeah.
And if you're doing something that is potentially not life-serving and potentially harmful,
Mhm.
then you're not doing a good job as a professional, and you're
Mm.
not doing a good thing as a member of society.
Yeah. So I can hear that you want to contribute to life through your profession more broadly as possible, and
That's
that
right.
one way is to reduce the prescribing of antibiotics, which will lose their effectiveness the more often they're prescribed.
And the other one is to share information with people that
Okay.
I would hope that they would take on board
Okay.
when I offer it in a
Hmm.
in a kind and gentle and in a research-based way, because I often suggest to people a podcast which is called Two Peds in a Pod. Peds is
Oh,
pediatrician,
okay.
and one of their it's done by Derbyshire Children's Hospital, and it's brilliant.
Hmm.
It's for professionals, but I think it sends a really clear message, because one of the podcasts is about fever management in children, and
Hmm.
the other one is about antibiotics. So I'm hoping to educate, and I
Hmm.
generally say to people, share this with your mum group,
Hmm.
you know.
Yeah.
So
So that yeah.
there's
So
a
what I'm
need
hearing
for
there.
respect and
Yeah.
to be contributing to wellness and good health.
Yeah, and I'm hearing also you want awareness, quite broadly, you want awareness of the implications, the impact of prescribing antibiotics especially when they're not really needed. They're not even necessarily going to be helpful for that person because
That's right.
something else is indicated. Yeah.
And that's kind of the focus of another of my YouTube videos that I'm doing, and that's on patient expectation because we
Hmm.
have to deal with patients' expectations. But that's for
Yeah.
another side. So you've got 100%. When I said I feel betrayed,
Okay.
the word feeling betrayed doesn't do justice to all the feelings that are there. You know, the
Sure.
feelings are raw and tender.
Yeah. Wow. Wow. Yeah. So I just want to acknowledge that it's still alive in you, that sense of hurt and rawness and tenderness in relation to this I'm hearing extremely painful situation at the time, and then afterwards, where you didn't get the kind of institutional support for how you dealt with the situation. Even as you were concerned, you acted in integrity.
Mm, yeah. So there was no recognition
Okay, so no
and no
recognition
support.
of
Yeah.
your no recognition and no support for how you dealt with the situation.
Mm,
Yeah, the effort that you made
yeah.
to address it. Mm.
That's really helpful. Thank you. And I hope people find that helpful about
Okay.
how things feel and to get in touch with feelings. And I'm kind of wondering how I could have been more empathic with the patient
Yes.
because
Okay.
I, I'm very open to
Yeah.
being more empathic. That's
Yeah.
my quest. And certainly one of the things that I wouldn't say next time is I wouldn't say I'm not going to be bullied. So,
Right. Yeah. Okay. Well, we might need to translate that. So what I suggest for that, Andy, actually is I suggest we do a little role play just for fun,
mhm,
and I'll be you and you be the patient. Okay. You can have
mhm,
some fun being the patient.
okay. So I've had this cough for 4 days and I feel a bit short of breath and I've got a temperature and I need some antibiotics to get rid of it, knock it on the head.
Right. So I can hear you've had it for 4 days and now you're worried about it and you're worried that
Yeah,
it's affecting you and it's just going to drag on and you want some
yeah.
support right now.
I want to get
That's
better
what it is.
quick. You know, I
Okay.
can't be doing this. I've got to go to work.
Okay. So you need to be well so you can do your work. And this is really getting in the way, this coughing and I can hear you're really worried
I'm
about it.
not sleeping at night as well.
Okay. So you'd like some understanding, some acknowledgement for the impact that actually it's affecting your sleep, it's affecting your life very generally. You're
Yeah.
not able to do your work effectively, and you've
No,
got to
and I
see
need
that,
some antibiotics to knock it on the head quick.
right. And I heard you need to get to work, you need to do your job to support your family, and what you can imagine that would make a difference is antibiotics because you've heard
Yeah,
previously it's made a difference. Is that how it is?
yeah, yeah.
Okay.
And I get better straight away as soon as I've got the antibiotics. I'm all
Okay,
right.
so your understanding of antibiotics is that cures you straight away. Is that how it
Yeah,
is?
yeah,
Okay. And you really need to deal with it now, today. Is that how it is?
yeah, yeah. I've got to get back to
Okay.
work.
Okay. So, do you want to hear my professional opinion about that?
Okay.
Okay. Well, I'm not so sure. Seems to me like your symptoms are viral. Sorry, let's try again. Yeah, your symptoms are viral. I'm not sure antibiotics are going to make a difference in this
Look, I
case.
know my body better than you. I've been
Okay.
here before. I've been here before. I just need some antibiotics.
Yeah. Okay. So is it difficult to imagine that you're going to recover from this without antibiotics?
I won't.
Okay. So you're 100% confident you're not going to recover from this without antibiotics.
100%. Yeah.
Okay. Yeah. Well, at a bit of an impasse then because my professional integrity is kicks in and it wouldn't be an integrity for me to uh, prescribe antibiotics when my impression is that your symptoms are viral. So I'm not sure where to go with this. All I can suggest is that you get another opinion. Are you willing to do that?
Well, I don't see why you can't give me antibiotics. I've had it for 4 days.
Yeah. Okay. So my understanding is that these things will go on for a while. It's just part of the normal cycle of illness, and that if you give it time, space, and rest, plenty of fluids, all those things, that that you'll recover. If you're not well in a week's time, then please come back.
Mm.
How's that for you?
Well, I don't really agree with you.
Okay. And
Well, I'm going to go and get another opinion.
yeah, I wish you well with that. Yes,
Okay. Thank you for that.
you're welcome.
Should we put a hold on the role play now?
Okay, yes.
Very difficult situation. And like I said, I wouldn't say I'm not going to be bullied by you anymore because I can imagine that was a bit inflammatory. So I
I
wouldn't
can
do that
imagine. Yeah,
before. Yeah.
yeah,
And
yeah.
you offered him to get a second opinion, which is what I did as well, but I could have done it
Okay.
differently.
hmm
Um, and I guess what I'm left with is the feeling for me is that I can't always please everybody all of the time. And that's normal, but it doesn't seem to be accepted as a norm.
Oh, okay.
That's what I
Mm,
observe. Yeah.
mm,
Because
yeah.
these things are viewed that they shouldn't happen, but there's a
Okay.
lot of work done recently about how um, there's a broad social change since COVID about
Mm,
how people are more demanding, expect it right away,
okay.
um, and are less tolerant of viruses and things like that, which raises the ante for complaints, I guess.
Mm, mm.
Yeah.
It could create a context in which people are more find it are more willing to raise a complaint. Yeah, yeah.
Mm. Yeah.
Mm,
So I guess part of that, I would want to go back to self-empathy
yeah,
after the event. What could we
yeah,
do for that?
yeah. Well, I say self-empathy or get empathy from others, from trusted others
Hmm.
before, during, and after challenging situations. So yeah, I would. So I live and work with my partner, Gazina, who's also an MVC trainer. So if we have difficult situations, if things, yeah, then we debrief. We take a chance
Hmm.
to debrief, or you know, I
Hmm.
for the restorative work that I do, I have peer mediation with
Hmm.
with a group of restorative practitioners. So that is really, really important for like, emotional well-being,
Hmm. So you can
and
get
that
that
includes,
from a colleague, and I guess you can also get that from what we would call clinical supervision.
yeah, yeah,
And I guess the last thing that I wonder how we could approach it is in that scenario, I didn't have my needs met. How
mm.
can I express that to the organization?
Well, I would say what you said to me, which is I was looking for support and acknowledgement for what for my actions, and I'd like some acknowledgement, if it is true for you, that I acted in integrity. I
Hmm.
would at the very least, I'd like some acknowledgement that I acted with integrity and to the best of my clinical understanding.
Hmm.
Yeah. And although I understand the GP's decision to hand over the sweeties, I'm not really happy with it because it left me feeling, uncomfortable and I didn't really get the acknowledgement that I would have liked. I was looking for the support that I was looking for from somebody who does have a broader clinical experience, deeper clinical experience.
Hmm. And I guess from that point of view, I think it's relevant to bring in power dynamics, rank and
Mm,
privilege,
mm,
in that non-doctors, me, a
mm,
non-doctor,
mm,
who is not happy with the doctor's actions,
mm,
that isn't in line with the
mm,
guidelines, very difficult for somebody to support my understanding that that's not been helpful.
mm, mm.
Maybe just, I suppose, there's a resilience of understanding the difficulty that you're up against.
Sure. Yeah, I heard that you really want understanding for that you acted to the best of your knowledge and
Yeah.
understanding and with your integrity.
Yeah. And I think if
Yeah.
I got that, I would feel accompanied and it
Mm,
would be less traumatic.
sure.
The whole experience is traumatic, and it's one of those things that is now recognized as something that can cause moral injury at
Mm,
work
mm,
and things that can lead to symptoms of post-traumatic stress disorder.
mm,
And that's part of the reason for having this discussion is
Mm.
to raise that awareness, and that's in
Yeah.
another of my videos about
Yeah.
um, moral injury, post-traumatic stress
Yeah.
disorder,
Yeah.
and disenfranchised loss.
Yeah. Well, depending on our childhood, our upbringing, or previous experience, sometimes experiences affect us very deeply and very
Mm,
profoundly, and can have
mm,
a longer term effect or a cumulative
mm,
effect.
mm,
Yeah, and it's important to acknowledge that, and to find some way of healing that.
mm. So we've dealt with quite a lot, and I'm really
Mm,
grateful for your
mm,
time. So thanks very much. And in summary, I would say we've looked at empathy, we've looked a
mm.
little bit about nonviolent communication,
Yeah.
and we've talked about empathy for oneself first in order
Hmm.
to be able to offer empathy to others, and how we can identify to organizations when our needs are met for uh, things like support and recognition,
Mm,
and I guess the words approval and uh, understanding that we've done the right thing and that it's not held against us.
mm.
That's
Yeah.
a fear that's there. Have
Mm.
you got any take-home messages before we go?
Yes. So yeah, so especially in situations like healthcare, where the role is mainly seen in terms of uh, educating people or correcting their
Mm,
understanding or correcting their behavior, especially in those contexts, adding in a moment of connection. So connection before
mm,
correction, or
mm,
empathy before education, even if it's
mm,
just a moment, just an acknowledgement of what they're coming in with.
mm.
Yeah,
And you've done that several times with me, saying, I'd
exactly.
like to acknowledge.
Yeah,
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 yeah.
yeah. And that is worth its weight in gold in clinical settings, because that's the bit that patients can, if they don't get it, they're really, really unhappy about. Even if they can't articulate it, it's like, oh, he doesn't understand me, oh, he just didn't understand. Yeah. Well, actually, it's that emotional connection of acknowledging what they're coming in with. Oh, so it's been going on for 4 days, summarize, and you're really fed up with it and you need to get back to work so you can earn a living and support your
Mm.
family. Yeah. And that's it. That might be enough, just to kind of establish rapport, establish a
Mm.
connection. So,
Rapport. Yeah,
yeah.
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 Okay, that's great. So we're coming to the end. Thank you very much. At
Mm.
the end of this, I'm going to put a couple of slides up, um, and I'd like to put a slide up of Seed of Peace MVC courses. So maybe we can sort that out.
Yeah.
And I would recommend that people read your book. It's been very helpful to me.
Right.
And you've got a new book coming out as well in next
I
year, is
have.
it?
In October, got a book
Mhm.
coming out on a Buddhist path of love and relationship. So looking at
Wow.
love in the Buddhist tradition. Yeah.
Yeah, that sounds interesting.
Mm.
So thank you very much, Shantigarbha. I'm going to turn the
Okay.
recording off and we'll
Yeah.
just close with each other before we go.
Okay.
Thanks
Okay.
very much indeed.
You're very welcome, Andy. Thanks for inviting me.